I too am frustrated, like Deputy Nocton, Minister, and we might have lots of questions in question time here. We ain't getting the answers. And as for the briefings, the one yesterday evening was a total waste of time. When will we expect to see smear test cancer services resuming and other essential health tests resume? Having arranged additional capacity for COVID-19 care in our private hospitals, and you and your department putting together plans to resume operations there, and it's to see there's ideological issues here coming up about all patients together, but people who have insurance and pay their insurance and waiting for treatments, they need answers. Mental health services, Minister, and Tipperary is still non-existent. While we wait the jigsaw services to get set up, disability, early intervention services have all been cancelled, and there's no idea of when these essential care services will resume for so many families. And mental health is a huge issue. And I've heard of a case recently where a suicide, unfortunately, was down to COVID. There's a lot of trick in the loop going on here, Minister, and Deputy Nocton called it organic manure. I call it something that with B and something else that with S, but I wouldn't want to say it in the House here. It's just not on. And it's time to stop the spin, give us the answers, and we see the love letters being exchanged now between Dr. Houlihan and senior officials in the HSE, and you can smile if you like, they're not love letters. They've been exposed today. Letters, not litter and alcohol, letters going from different departments to different officials, and a jealous kind of questioning of who's who and who's what. We need to put accountability back in this floor here, in this House. And what Deputy Nocton and Count Calder intervened there about letters going, or test results going to meat factories. I wouldn't be surprised what had happened in meat factories, because they literally own the workers, own them. I have many questions about testing arrangements for COVID too. In one case, an 80-year-old minister, my constituency in Clonmel, had to get another 80-year-old or 75-year-old to bring him to testing in Kilkenny, in spite of the fact that we have a test centre given by my Rovers GA club of some fame, and it's actually empty and not working. So what is going on? Can we have some transparency about the number of tests being done in my Rovers, and indeed the one in Nina as well, Minister? Where are the answers? My office is still awaiting replies from your department, Minister, over 3 weeks at this stage, and from the HSE about facilities and the funding in Tipperary. St Bridget's Hospital, a lovely hospital, district hospital as it used to be. Many people in Carrick-on-Suir were born there. Many people in Carrick-on-Suir lost their loved ones, and they were awake there before we had funeral parlours. And Minister, it was taken over for a COVID centre. Now it's empty. The lights are switched off. Total darkness. And now beds are being removed to be put into Cashler, where you and I visited one day and saw that pristine empty hospital. Minister, people in Carrick-on-Suir and surrounding areas, West Waterford, South Kilkenny and all over Tipperary, funded those 3 hospice beds that are in there and other facilities, and we need answers. I can't get answers off the HSE. I can't get phone calls returned, or I can't get emails replied to. So where are the answers? Minister, unfortunately, the usual issues about the HSE that I raise in this floor, and many other deputies, day in, day out, are still there. They might have gone down in the pecking order, but the cardiac care service in the south east are still non-existent. Dentistry, orthodontics, speech and language services, and the list miles long in the public system. How long are they going to be, or will we have the chaos again? Minister, the worst of all, I think, is what happened to nursing homes. Pure, and I won't repeat it because I said it here today to the teacher, pure, literally, they were thrown to the wolves and blocked and blackguarded. And what did we do when we had to give them a response? Send in the usual suspects, HICWA, who had to hire in experts from other areas that doesn't at all to get for form filling and a paper ticking exercise. Minister, the people with intellectual disabilities and the children with autism, their parents and families, you must feel for them, because they have had no, with some excellent centres in Tipperary, many voluntary and community run, they have no outlet, they have no one to look after them, they get no break from the family, or the children get no break away from the family, you know, where they need it, when there's 24/7 care in their home. And there are many young adults that I see now who are just pure frustrated and younger, but it's easier to control them, I suppose, when they're smaller. But when they're big, strong, boys and girls, young men and young women, it's just so desperate on them that they can't get access to the services. Even the trip on the bus with their other colleagues, you know, that are going to school with the excellent bus drivers and carers and people to care for them. Look, that's so necessary, badly needed, and has to be put back out there in some semblance of way to give those, to keep them sane, the families, because they're just under enormous pressure. Enormous pressure. I can't quantify the pressure that they're under. And Minister, the over 70s have put their shoulder to the wheel, but they've been knocked up for long enough. And they're asking questions, and we're all asking questions, and we want just more, less of the spin on RTE every evening, 6-1 and 9 o'clock news, and more of the honesty. And the last thing they want is when the Taoiseach says something for the 6-1 news, and when his spin machine is outspun, and he's a fair machine, by Dr. Houlihan about challenging him with something else. That is divisive. You rightly praise, and so did every other deputy, the front line and all the citizens of the state for what they've done. But they need to be seen. One message has to be an honest, direct and fair message. Thank you.
Hospital. Look, Deputy McGrath, thanks very much for raising a range of very serious issues. Can I just say this, though? The only reason we've suspended any service is to save lives. So I just, nobody wants to suspend a disability service. Nobody wants to suspend a screening service. The reason we were doing it was to make sure we didn't see people die and more people die of COVID-19 in our country. And that's the only motivation, was public health grounds. You are right, though. We now need to try and put a plan in place to safely bring back some of these services in a manner that recognises that this virus ain't gone away. And we're going to have to work out a way of living alongside it, keeping the staff safe, keeping be they residents, patients, citizens safe who use the services as well. And I've outlined the process that we put in place in relation to our screening services. There is a plan being devised in relation to how we can try and provide some supports to children with disabilities. And I thank you for raising this, a very serious issue. There's been a lot of children with disabilities who haven't had a school intervention or a health intervention for many months. And we can't just say, see you in September. That would be an entirely inappropriate and offensive and irresponsible approach. So I am working with colleagues in the Department of Education to see what we can do for them over the summer months. And it'll have to be done in a safe way, physically distanced way as well. But there are things that we need to do to support them. In relation to St Bridget's, my understanding, I have a note here that I won't have time to read out, but my understanding is that admissions will recommence there when there is a demand, and I want to provide you with that assurance. Obviously, in relation to over 70s, and I'm sure you didn't mean the language in relation to locked up. Nobody's being locked up. What we're doing here is giving people over, no it isn't, what we're doing here is giving people over the age of 70 the very best medical advice to keep them safe. But I know it's been really tough for them, and we're eager to see that situation improve as well. And in relation to Jigsaw and Tipperary, I obviously had a meeting with Jigsaw, and I know what they are doing in the interim when their services on the ground can't be in place. It's moved a lot of services online to try and provide some degree of support to young people in Tipperary in the interim, and jigsawonline.ie I think has a lot of help for young people in Tipperary at the moment.